In my initial years of practice, I think it's in the first year only, a middle-aged parents came with their daughter of 12 years old to me. She had complaints of severe jaundice with hematemesis. Always be with the people who are very close to you. It will always keep you in a good mood. And suppose somebody is having severe vomiting, try this thing, yela with the lemon juice, or if you have some burning situation, you can have jeerakam with the coriander. Regarding mixing of Ayurveda with the allopathy drugs, cocktail. Ayurveda is a very vast subject. Each and every part of the subject is also a heart of the Ayurveda. I was very much interested in Dravyaguna. There is no problem with the students. The problem is with the teacher. It created some disturbance in me, but still I carried on. Sita was sitting under this Ashoka tree, and it relieved her shoka. That's why it is called as Ashoka. This is a plant called Strikotaja or Raitia tinctoria. In Malayalam it is called as Ayapala, which is used in the treatment of psoriasis. The oil of it is called as Ayapala Keratailam, made out of this plant. Namaskara. I am Lieutenant Dr. Bharathesh from Karkala. I did my BSAM from SDM College of Ayurveda, and then after that I joined Bangalore Medical College in Bangalore to study a short-term course in allopathy medicine after my completion of my BSAM. And since 1981, and after that I worked in Kotkala Ayurveda for about 10 months. Then I have started my practice in the year 1982 along with my uncle in Jeevan Clinic, Karkala. That's my initial stages of my journey. And regarding, you asked me who is the inspiration for me. To be frank with you, I am born in the family of Ayurveda Vaidyas. I am the third generation Ayurveda Vaidya in my family. Initially, my grandfather, late Adira Shastri, was a Shastri in both Ayurveda and Sanskrit from Banaras Hindu University. And my two uncles are also Ayurveda physicians. And regarding who inspired me to join this profession, as you know, I am from a Ayurveda traditional family. My inspiration is my grandfather, Adira Shastri. Although I lost him when I was 5 years old, my mother and my grandmother used to say about his Ayurveda success story. And he was a very famous Vaidya in those days in our district. So that inspired me to become like a great Ayurveda practitioner in life. As I said, I born in the family of Ayurveda Vaidyas. My inspiration is my grandfather, late Adhyaya Shastri. Although I have not seen him because he was passed away when I was 5 years old. My mother and grandmother used to tell me about his success stories of Ayurvedic practice. That inspired me to become a Ayurveda Vaidya like him. And in my childhood, uh, all my uncle and my grandfather, they used to prepare their own medicines in our house only. So in my house, ours is a very giant family. There were about 20 members in the family. Everybody were knowing the art of doing medicines, preparing medicines, etc. So since my childhood only, I learned identifying the drugs and preparing medicine. Everything that created an interest in me to join this profession. Well, I have started my clinical practice in the year 1982. Those days, I began my practice with my uncle in his own clinic. So he was very dashing and very experienced Ayurveda physician. When I joined, I was a very mild guy. I do very with smiling face and all, but I didn't talk too much. So I had a doubt whether I will reach my uncle's status like that. So with a little bit of hesitation, I have started my practice. Initially, the patients were going to my uncle's side only. They were not coming to my side. Sometimes when he was not there, they just see from the window only whether my uncle is there. They used to come inside, and if he was not there, they used to go back. It created some disturbance in me, but still, I have carried on. For some days, they slowly started to coming me, and they were fascinated with my way of handling the patient and my talks and all. They were impressed. And my uncle was with me for about 6 to 8 months. Then he retired from the practice. Then slowly the people started having confidence in me. Slowly everybody liked my way of practice, and slowly I was improving in my practice. Sometimes I was so busy that I used to go home at 3 o'clock for lunch. So that was the trend those days. And of course, with the profound knowledge which I gained my teachers, especially my great guru, our principal of our college, Dr. R.R. Bhatt. He was a great teacher. He was a uh, he has trained from both Ayurveda and Allopathy. He has to give us confidence in us to practice in Ayurveda only. At the same time, he was pressing us to know the all the modern knowledge of allopathy medicines also. You should know the allopathy system, but you should practice in your own system. That was his uh, guidance. In that way, I have started my career, and of course, I have succeeded in that. He always used to say that you need not label all the diseases, but you should know the what are the affective dosha and dhatus in that disease, and also the stage or the avastha of the disease, and also the you should know the bala, agni, and samarthya of the patient to receive the treatment. So in that way, I have succeeded in my practice, I should say rather. And also along with this, as I said, I had the knowledge of Ayurveda Vaisheshya Kalpana also. I used to prepare some of the medicines in my clinic and in my home also. That gives me some great strength in my practice. Along with that, I should always tell my interns regarding this. You should blow your own trumpet, because you have to propagate Ayurveda in the community. In that way, I have succeeded in that also. When during Sundays, actually, along with my practice, I joined the Service Organization Rotary in the year 1987. Through my Rotary career, I slowly started conducting some medicinal plants identification programs for the school children and some of the youth clubs, some of the women's health group also. That created some interest in the community also about Ayurveda. Along with that, I was little bit my hobby along with the Ayurveda. My hobby was cooking. As you know, Ayurveda should be Ayurveda Vedya should be a good cook also, because we have to prepare some kashayas, some arishtas and all. You should know the art of cooking also. So I was teaching some women regarding how can we use these all the medicinal herbs in our food, because you know our ancestors were gaining Ayurveda not through medicines. They were using these medicines as their food. So I have started teaching this Ayurveda cooking also amongst the women in the community. That also given some boost to my clinical practice also. Well, regarding my earlier days in Ayurveda college, our Ayurveda college was very much away from the city. Those days, it was there were about only 25 students were allowed to join the course. Actually, for the first time, ours was the year where 25 all these 25 seats were full. As you know, Ayurveda is a little bit sometimes it looks like a dry subject, because the subjects of Ayurveda like Ayurveda Mula Siddhanta and all, no, that looks like something religious subject. Of course, I was interested in that. For some, it was a very dry subject. So I always say to inspire our students that there is no problem with the students. The problem is with the teacher. He should be able to understand the Siddhanta or the principles of Ayurveda, like Tridosha Siddhanta or Samanya Vishwa Siddhanta or this Shadrasa Siddhanta. You should be able to understanding this theory to our students. There is no problem with the students. So we had some very good teachers those days. I was very much interested in Dravyagana, as you said, because botany was my favorite subject in my PUC level. I was very much interested in taxonomy, that is studying the family of plants, the structure and everything. So we had a very senior teacher. He was a retired government professor, then joined our private college. He is Sri Vijayendra Murthy. He was from Mysore. He was, while explaining the plants, no, he was telling about his Purana stories along with the description of the drug. For example, when he used to explain this Ashoka plant, he used to tell that Sita was sitting under this Ashoka tree, and it relieved her shoka. That's why it is called as Ashoka. In the same way, this was the how Rama explained about this thing, Ashoka plant, because should know, Hanumanta should know what is Ashoka tree. So he explained this Ashoka tree. So this description of this drugs was there since the Purana Kala also. Yeah, that's in this way it was inspiring us to memorize the plants and all. As you said, I used always tell my students, you should have developed that interest in you. Not only in the classes, you should have, whenever you go outside, watch every plant in the environment. You should be able to uh, identify each plant. There is a saying in Ayurveda that Anaushadam Dravyam Nasti Iha, means every plant is a medicinal plant. So only thing we don't know the importance and know how of that plant. That's the main thing. So I used to, when I go outside, I was interested in this environmental science also. That's how I enriched my knowledge of this Draviganam. And whenever the interns come to me, every day I used to bring some plants and asking them about this, about the plant and all. At least I am creating some interest in them. Although we had a very limited resources, like only few teachers were there, and also the infrastructure was very minimal. We had a very small hospital of about 25 beds, and one small herb garden was also there. So we had great teachers like Dr. R.R. Bhatt. As I said earlier, he was a great teacher. He used to inspire all the students with his clinical expertise. Always used to go to his OPD with great interest. I think what I am today is because of his the expertise or knowledge I gained from him. And also we had a very good teachers in Rasashastra. One Dr. Mukund Bhatt, actually he was my grandfather's student in Banaras. So he was my teacher in Rasashastra, and in Vaishya Kalpana also we had great teachers like Dr. Ramesh Harwalkar, who taught us a great knowledge of using of Rasaushadhis in skin disease. That was the one biggest knowledge we have attained from him. I treat my patient. In treating patient, history taking is very, very important. Like when did it started, what are the symptoms, what are the things aggravate the things, and in Ayurveda, Agni is very, very important. We should know how is the appetite of the patient, and how is the dosha avastha is also very, very important. And along with that, we should know their family history also, because if the one patient of the family is affected, it will affect the other this thing also, or some of the diseases like tuberculosis will run in the family also. That's why family history is also very, very important. And as you know, we belong to a very taluka level. The financial condition of the patient is very, very important, because everybody cannot afford the costly treatment for the ailment. So we must always think of the financial condition of the patient also while treating their diseases. You know, Ayurveda is a science of life, or it's a way of life. As we, the Ayurvedic practitioners, before telling others, we should practice it. Then only it has the value. As you say, in Ayurveda, lifestyle is very, very important. I get up at 5:30 in the morning, do some little yoga exercise, and I go out for walking. And also about regarding my food, I am very, very simple. I am my food is very, very simple vegetarian diet. So as I said earlier, I always prefer this traditional way of cooking. As I said, I am a good cook also. uh, our my mother was a very good cook. Earlier days, no, we didn't we don't bring any vegetables from the market. We'll go. My mother will go outside and bring some leaves, make a chutney out of it, or bring some leaves and do some rasam like that. For example, we have Agnimanta plant in our garden. She will prepare a very tasty chutney out of it, which will improve our Agni and keep us always healthy. The same way, we can prepare some tambuli, means along with the curd we make some chutney. It's called as tambuli. Can use this thing that brahmi chutney, or so many that colocasia, or we call it as chembu, or kesu. It's also very good. You can also prepare a very good chutney out of it. Along with that, I know how to prepare some of the good drinks out of some of the tangy fruits, like this thing, tamarind and amalaki and passion fruit and one brinda, like that. They're all homemade juices which will improve your health also. And one more, this thing is in Dinacharya we call it as Swasthavritta. In Swasthavritta say, to attain good health, Aptopasevi is also very, very important. Means you should have you should mingle with good people and do some community service which will improve your health. This is also one way of propagating Ayurveda in your life. To understand Ayurveda, should know the fundamentals like Tridosha Siddhanta. They say, Vata Pitta Kafascheti Trayodoshaha Samasataha. There are three doshas in the body. They are Vata, Pitta and Kapha. If they are in equilibrium, there will be health. If the equilibrium is lost, there will be disease. This is the Tridosha Siddhanta. To understand Tridosha is a very difficult subject. There is one more shloka when we were in the first year, very common shloka we have learned. Vata Pangu, Kapha Pangu, Pangavo Maradatava, Vayuna Yatra Niyenche, Tatra Gachanti Megavat. So, in Tridosha, Vata is very, very important. Both Kapha and Pitta they are not mobile. And even the Saptadhatus, like Rasasring, Mamsa Medosti, Majja, Shukrani Dhatva, all these 7 dhatus they are lame. They don't move in the body on their own. So if you want it to be moved in the body, Vata is the only thing. Just like as clouds move with the help of air, in the same way, all these Kapha and Pitta Dhatu, along with Sapta Dhatu, they will be moved in the body through Vata. That's why Vata is very, very important dosha in the body. All the activities in the body is obeyed by is governed by the principle Vata dosha. And Pitta symbolizes the metabolism in the body, like digestion or assimilation of the food in the body, or any formation of the blood, like etc. All the metabolic activities are carried by the activities of Pitta. This is also very important. And the third one is Kapha. Kapha governs the structure of the body, like it is the principle which hold the cells together. We call it as bandhana. Cells together and form the mamsa, majja and astidhatu in the body. So, primary function of the kapha is giving protection to the body. This is all in short the description of the Tridosha. And there is one more Siddhanta, that is Shadrasa Siddhanta. because as you know, all the things in this universe, including body, is made up of panchendriyas. Like, what is it? Prithvi, Apa, Teja, Vayu and Akasha. All the things, whether it is living or non-living, everything is made up of these 5 elements. In the same way, all the food is also made up of this panchendriya, and it has 6 tastes. What is it? Rasaha, Swadvamlarvana, Tiktoshana, Kashayakaha. That is, Swadu means sweet, Amla means sour, and Lavana is salt, and Tikta is bitter, Kasha is astringent, and Kasha is an astringent. Tikta Ushana means this thing, pungent. All the food items have these 6 qualities, and after which Tatradhyaha means Swadu Amla Lavana, they what is it? Their Vata Haradravya. Swadu Amla Lavanaya, they diminishes the Vata in the body, and if you take more such subjects, such taste, it will increase the Vata in the body. And Tiktoshana Kashayakaha, they decrease the Kapha Dhatu, Kapha Dosha in the body. If you take them in large quantities, they will increase the Kapha in the body. In the same way, Kashaya Tikta Madura, they decrease the Pitta Dhatu in the body. If you take it in moderation, they will maintain the balance. If you take them in more quantity, it will increase the Pitta. Is it not? So, this is the Shadrasopayata, Shadrasa Siddhanta in the Ayurveda. The same way Samanya and Vishesha Siddhanta is there. If you take the food which is has the same qualities of Vata, it will increase the Vata in the body. If you take little or in a balanced condition, it will maintain the Vata in the body. If you take them in excess, it will increase the Vata in the body. This is called as Samanya and Vishesha Siddhanta. So you should always know this basic principles of Ayurveda while treating the patient. About the heart of Ayurveda, it's very difficult subject to answer, because Ayurveda is a very vast subject. Each and every part of the subject is also a heart of the Ayurveda, because unless you have the basic knowledge of dosha siddhanta, everything is zero. If you prepare your own medicine, sometimes you can give it to the patients with the utmost confidence. So the knowledge of plants as well as the Aushadhi Kalpana is also very, very important. And above all, you'd have a kind heart in you. That's see, Ayurveda doesn't only teach us the method of treatment, it also gives the values of life. That is very, very important to be a good Ayurveda practitioners in my view. Regarding that, always there is a saying, Ati Sarvatra Varjayet. So always have moderation in anything, even in the taste and all. In the season wise, you have to prefer your food. In rainy season, like you have to have some Ushna Dravya Aharas like this thing, the Skatu, Tikta, Kasharista Ahara is always preferable in the monsoons. Even in the summers, you can have sweet, sour, Madura, Amla, and Lavana can have in the summer season. You can have such cool things in the summer. And those who are in Kapha Prakriti, they should prefer always a little bit of spicy food in their diet. And regarding first aid through Ayurveda, for smaller ailments, I think all our people you prefer always your home medicines for your earlier requirements. Suppose somebody is having severe vomiting, try this thing, ela with the lemon juice, or if you have any some burning situation, you can have jeerakam with the coriander. Like that, if there is any indigestion problem, you can use hing with the buttermilk. Like that, you better always prefer home remedies for the primary use in all the diseases. If it doesn't subside, then go to doctor. This is my humble advice to you you all. And as I said, you can use all the herbs as a food in your daily routine. As I said earlier, all these sambar dravyas like dalchini, ela, pepper, and you can use it in a chutney, sambar, and all. Like that, some of the cooling agents like ushira and chandana, that can be used in our daily water drinks, like that. So in that way, you can preserve your health in daily routine life. Regarding mixing of Ayurveda with the allopathy drugs, cocktail, or it's called as mixopathy also. Whatever it may be, see, the aim of Ayurveda is, what is it? Swastasya swasthya rakshanam and aturasya vikara prashamanam. Our main aim is to get rid of the disease get rid of the pain from the pain of the disease for the patients. That's our main aim. So, suppose a man with the severe angina comes to you, then do you say that I am an Ayurveda man, I can't treat like you? Do you say like that? No, that time you have to, the prime duty of yours is to save the life of the patient. Then you can use allopathy drugs also. There is no harm in it. But I think you can cure almost all the diseases through Ayurveda treatment only. Suppose a baby comes with a febrile convulsion. Do you say that I can't help you, I can't treat my fever with our drugs? And do you say like that? Then you have to give them some of the antipyretic drugs also and get rid of the febrile convulsion. In that way, so whenever there is an emergency, you can definitely use allopathy drugs along with Ayurveda also. About my interesting stories of my clinical practice. In my initial years of practice, I think it's in the first year only, middle-aged parents came with their daughter of 12 years old to me. She had complaints of severe jaundice with hematemesis, that is vomiting of blood, with a huge belly, which we call it as jalodhara, that is ascites, and also with a very heavy legs with the severe edema. She was very much pale. She had a severe problem since about 2 months. They have tried the medicines in almost all the big institutions in Mangalore with little bit improvement. They were not satisfied with that. Then somebody told that in Kakla there is one doctor who treats this liver disorder. They came to me. Yes, by looking into her, I was a little bit nervous whether I can treat this type of patient or not. Still, with the confidence and advice on clinical approach which was given by my teacher, Dr. Bharathesh, I have proceeded to treat her. As you know, as you said, we should think of the dosha and dhatus which are involved in disease. This, as it is a case of severe jaundice and omnitiveness, actually doshas involved are dosha involved is pitta dosha and dhatu is rakta dhatu. So, and her condition was a bit pathetic. She was not able to eat also. Then I have thought of improving her this thing also, Agni also. So I plan my treatment in that regard. So I gave her this thing, Kumari Asava, to improve her digestion. Along with that, Rakta Prasadana Dravyas like Pravala and Godanti Basma and Jalodhara and all I have given her. Arogyavardhini and Patola Katuravinyadi Kashayam along with the Tapyadiloha. In a slowly I have increased the dosage and all. Within 10 days, she showed a little bit of signs of improvement. I was a little bit confident then. So in this way, I have treated her for about 4 months. With 4 months, she was completely all right and gained about 5 kgs of weight also. They were very happy. This was the first incidence which gave me to a little bit of courage and confidence in me and also in Ayurveda practice. Of course, this gave future this thing also, confidence in treating all the liver disorders with a great confidence. And now also I am always treating most of the this thing, alcoholic liver cirrhosis, etc. I am treating with confidence because of this earlier treatment success. So they were very happy. Now also she has grown now with her 2 grandchildren. She met me last month. She says, so I am such and such. I told her I am such and such girl whom you have treated about 40 years back. Now I came with my grandchildren to you. So that was, I always don't forget your courtesy towards me. She said it was a very heart-touching incident for me. There are so many such incidents in my life, of which I have shared only one. Yeah. And regarding the future of Ayurveda, especially for my young Ayurveda students, so you have bright future. What we have explored in Ayurveda is only a drop in emotion. You have to so much to explore. The possibilities are enormous. So through Ayurveda, you don't go to practice only. You can go to biotechnology or environment science or natural science or Ayurveda pharmacopoeia. The opportunities are plenty. You should explore it and should have great interest in that. You have to dedicate yourself to the science. Then only definitely you have bright future in this regard. Yes, as I said, we have still not explored many medicines. Last month, Sri Dutpapeshwara committee had one webinar on their Potali Kalpas. We have heard of only Potali Kalpas. We don't know how it acts on the patients and everything. So, there was one general surgeon from Bangalore who treats, is also an oncosurgeon, who treats his patient after surgery. He used to give them Potali Kalpas, which improved the quality of their life. I was really astonished. So, as I said, you have to explore so many things. We have very great treasure in Ayurveda. The problem is we have to uncover it and explore it. Then only you will definitely have a bright future in your career. That's my humble request to you all. Regarding Ayurveda and modern life, so health is always needed in any era whether it is ancient time or the modern time. Health is always needed. There is a saying in Ayurveda: if you attain good health, what you have to do? Nityam hitahara vihara sevi samikshakari visheshu asaktaha data samaha satyaparaha tapovan aptopasevi bhavatyarogaha iti. That is, the meaning is, really have food in moderation. As I said, hita and mita, it should be in limits, and it should be very Satmya, which is very which gives happiness to others. Should be the food should be like that. And vihara means just like exercises, walking, and any this thing. Modern exercises like how you have in moderation. Nityam hitahara, vihara sevi, samikshakari. Before any act you do, you have to think of it, whether it is helpful to all the people or it's only helpful for mommy. Whenever you do something, no, it should be helpful for all others too, along with you. Vishayeshu asaktahanan means should not be have a more of luxurious life. Nowadays, people want luxury in every aspect, but that will lead to more stress very and all important. That. Actually, that always be with the people who are very close to you. It will always keep you in a good mood, and in that way you can be away from the diseases. This is my this is the what Ayurveda says. It will be universal truth for all our lifetime. And one more thing, I love the teaching profession, but I could not become a teacher because of so many reasons. Still, when I started practice, some of the students from the nearby Ayurveda colleges came to me for their clinical experience. They used to come to me, and then I thought of asking that college administrator, send them every month, send them 2 patients to me so that I can share my knowledge of Ayurveda, of which I know. So I thought of inviting every students of the nearby college, and I give them the clinical experience along with the preparation of Aushadhi Kalpana, and I have a small setup of daycare Panchakarma center through which I can teach them some Panchakarma procedures also, which has very much appreciated by all my interns. So that had given me the satisfaction of sharing my knowledge of Ayurveda with our future generation. That's also a very touching experience for me.